to our program today on decisions you need to make about your transplant choice. We are glad to have you here today and wanted to make you aware of transplant resources and information that's available on our website at dpcedcenter.org. You'll find information about kidney transplants, patient stories, articles about when a transplant fails. So we encourage you to visit our website. And then we also have done other programs on various aspects of transplants. And so you will see there's we have another program that Dr. Melancon has done for us. We also have webinars that have been recorded that talk about the need for the support team and just what's involved with becoming a transplant patient. And again, we invite you to visit our website to see some of those past programs as well. And as a reminder, all of your phones are muted. And to unmute at the end of the program, if you have questions, hit #6. *6 will then mute you so that other people will not be hearing private conversations or dogs or phones. You can also ask questions through the chat box, which we've talked already a little bit about before we got started with the program. We also will have the recording and slides available. They will be available on our website, and you'll get the link probably in about a week. And at the end of the program, there is a feedback form, and we certainly value you taking just a few minutes to let us know what you thought of the program and other topics that you would like to see coming up. At this point, I am so pleased to welcome Dr. Keith Melancon to our program today. He is the director of the George Washington Transplant Institute, a professor of surgery, and working and researching in the area of with minority patients, and transplants have been of keen interest to him. He also is an advocate to improve the outcomes for some of the hardest to transplant patients. And so he is with us today, and we'll be talking more with you about transplants, donation, and at this point, Dr. Melancon, I will turn the program over to you. We are, and I can hear you fine, so I'm going to turn the program over to you.
Okay, all right. So
Thank you.
I'm looking forward to speaking to you guys today. We're going to be talking about kidney transplantation, and I think this is very, very important because this is the best form of therapy for patients with end-stage kidney disease. My only question is, am I going to control the slides, or are you guys going to control them?
You can control the slides. You can control the slides. Do you see the arrows in the left-hand corner of the slides?
Yes.
Okay.
Okay, I got it. All right, so
Okay,
yeah, no, thank you so much. So my relevant financial disclosures is that I'm a speaker for Dialysis on occasion. All right, let's move on. So this is the issue about kidney disease. The problem with end-stage renal disease is that people die because of their kidney disease, even with this life-saving therapy, dialysis. So one of the scenarios I always like to give my students is, imagine a room with 100 patients, and in room 1, the patients all get dialysis, and in room 2, the patients get kidney transplants. If you fast forward, wait, let me just go back to that slide. If you fast forward to 10 years later, the patients in room 1 that got dialysis, only about 20% of those patients are alive. However, the patients in room 2 that received a transplant, over 80% of those patients are alive. So when we talk about transplant, we're not just talking about an operation, we're talking about saving lives. There is a marked difference in people that get transplanted versus people that stay on dialysis insofar as their life expectancy. Okay, true or false? A living kidney donor will usually be in the hospital for about a week after surgery. That is false. A person that donates a kidney is only in the hospital about 2 nights. That is the truth. So it's important when you talk to people about this operation, live kidney donation, that they understand that they can donate their kidney and be back to normal activities pretty quickly. True or false? A living kidney donor will have to change their diet after donation. That is false. There are no dietary restrictions after kidney donation. A kidney donor can eat anything, but like everyone else, should follow a balanced diet. So there's no real changes in what you eat after you were a donor. This is an important statistic. 30 million people in this country, or 1 in 7, have chronic kidney disease. If you have chronic kidney disease, you're going to need some sort of treatment. The treatments are going to be either dialysis or, like I said, transplantation. People with end-stage renal disease have to have either dialysis or transplantation to survive. Now, the dialysis can be hemodialysis or peritoneal dialysis. Peritoneal dialysis is done at home. Hemodialysis can be done either in a center 3 days a week for about 3 to 4 hours each time, or it can be done at home if you have someone that can help you to insert the needles and so forth. So renal replacement therapy is either going to be dialysis, hemodialysis, peritoneal dialysis, or transplantation. In transplantation, we have this symbol from Greek mythology. It is the chimera. The chimera is an animal that is a serpent, a dragon, a goat, and a lion. The reason why that is the symbol for transplantation, because we utilize that term, that Latin term, chimerism or chimeric, to denote what a person is when they have an organ from a different person inside of their body. All of our patients are macrochimeras because they have this new kidney, but they're also microchimeras. The cells of the donor are in their body after transplantation. The actual operation for a kidney transplant is done anteriorly. In other words, where you get the kidney is not necessarily where your native kidneys, where God made your kidneys. Your kidneys sit in the back of your body, but when you get a transplant, it's more anterior. We make that incision between the umbilicus, the belly button, and the bone on the right side of your abdomen or the left side of your abdomen that you can feel when you press on the lower part of your abdomen. That's called the anterior superior iliac spine. We make that incision and we leave in the kidneys that you were born in to place this new kidney in this anterior location. Why transplantation? Well, if everyone that had kidney disease could get a transplant, we would have an ideal situation. But really we don't. We don't have an ideal situation. What we have is over 100,000 people are needing a transplant. They're on the transplant list. Now it's about 120,000 people. And we do about 20,000, or maybe a little bit less, kidney transplants a year. There is a great demand for transplant. So for the person who needs a transplant, they need to be making sure that they are going to be in the best shape possible to qualify to get on the list. Remember, there are about 1 million people in the country that have kidney disease, and there are going to be hundreds of thousands of people that are on dialysis, but only about 100,000 or so actually get on the list. And that means a transplant center had to choose you to actually qualify to be on their transplant list. So for people that need a transplant, they need to make sure they're in the best shape possible. One of the things I can tell you right off the bat, you need to make sure that you are not abusing drugs, that you are not smoking regularly, that you're not overly obese. These are some of the things that the patient can control that are going to make them a good candidate for transplantation, because there's a limited supply. Unfortunately, we don't have enough kidneys to transplant everyone. So every single transplant center in the country has a fiduciary duty to take care of these limited resources. The types of transplant are either going to be from a deceased donor or from a living donor, a live donor. The deceased donor transplants are what you sign up for when you go to a transplant center. When you go to a transplant center, what they're going to do is they're going to evaluate you to see what sort of a candidate are you to be on their list. I can tell you honestly what they're going to be looking for. What they're looking for are patients that don't have active cancer, that don't have an active problem with some sort of drug abuse, and are going to get a good report. If the patient's on dialysis, it's important that the transplant center is able to get a good report from your dialysis center. So what kind of report comes from the dialysis center? The dialysis center has a report card for everyone that's on dialysis, and they will tell the transplant center if you come into dialysis fluid overloaded versus not coming in fluid overloaded. In other words, do you follow your restrictions as you are supposed to insofar as how much liquid you're supposed to drink every day? The dialysis unit will also be able to tell the transplant center if you have missed any of your scheduled appointments. That's also going to be seen as a problem, because the compliance with dialysis is going to connote what kind of compliance you're going to have as a transplant patient. They're also going to tell us what your labs look like. Your dialysis labs are indicative of how compliant you are being with the medications that the dialysis doctor is giving you. Is your potassium high? Is your phosphorus high? Are you taking the medicines as prescribed? These are the sorts of things that the transplant center is going to want to know before they will put you on a list to qualify for a deceased donor transplant. The other type of transplant you can receive is a live donor. Live donor transplants are going to come from people that you know, either your family or your friends. And they need to come in and go through the same sort of a workup that the recipient of a transplant would go through. There are lots of hoops that a live donor needs to jump through, because it is of the utmost importance that someone that is trying to donate a kidney, trying to do this beautiful thing, that they are not hurt in any way by being a kidney donor. All right, let's go through the donor operation, what the donor will go through. All right, after you donate a kidney, you're going to be in pain for 3 to 4 months. That is not true. A donor can come in, have their operation, and they are going to be back to their normal self within 2 to 3 weeks. Now, of course, it's going to behoove the prospective donor to have enough time off from work so that they can recover at home. We would like a live donor to be able to take off a month from work, but a patient is usually not in any pain after about 2 weeks. A living kidney donor must be about the same age as the recipient. That is absolutely not true. Even with a great difference in age, donors can donate to anyone. So a very young donor can give to an older person, and an older person can give to a younger person. What we will do as a transplant center is we will make independent evaluations of people's candidacy on the recipient side and on the donor side. We do try to match people as well as we can, but the most important thing for a donor is that they are healthy. If a person is healthy, they can donate a kidney if they don't have kidney disease or have some other medical problem that would preclude them being a kidney donor. So why the difference in live donors versus deceased donors? Well, first of all, I can tell you there are not enough deceased donors to go around. And the best type of donor is a live donor just because those kidneys tend to work better for a longer period of time. So the difference in survival of that kidney is almost 2 times the difference. A person that gets a live kidney donor has a 86% chance of having that kidney still working 5 years after transplantation. Has a 93% chance of it working 5 years after transplant, compared to 86% if it's a deceased donor. And for 10 years, it's an 89% chance of that kidney still working, whereas it's only 46% for a deceased donor. So the live donor kidney is the best type of kidney you can get, but either the deceased donor or the live donor is much better than the survival would be if the patient had to stay on dialysis. True or false? A live donor cannot be older than 60 years of age. That is false. The oldest live donor that I've ever done was 80 years old, actually 81. So we've done donors that are much older, and the only requirement is that they be healthy with excellent kidney function. So people can donate well beyond age 60. So the live donor kidney surgery, donors are selected after careful consideration. Routine approach for the procedure, it's done pretty much laparoscopically with these tiny little incisions, and that's why the patients can get out of the hospital so quickly, only about 2 to 3 days. There's very little pain, particularly after the 2 to 3 days, and the donors can return to normal activities within 4 to 6 weeks. What are the risks? Well, there are risks for being a donor, just like any major operation. Primarily bleeding, infection, pain. There can be any sort of post-surgical complications. And some people do have a little bit of a longer recovery if they heal a little slower. But the risk of the operation are actually very minimal, and it's about the safest major operation that can be done in medicine, primarily because we do such a good job of picking the types of people that can be donors. There have been donors that have died after the operation, but it's exceedingly rare, and it's on the order of oral surgery that these patients do so well after a major operation like this. What happens after surgery? Quality of life of a living donor is comparable to any normal adult. Donor is in great condition health-wise. Extensive testing and complete physical workup is done prior to donation. So again, the major work in this operation is done on the pre-operative side. The types of people that want to be donors have to undergo this extensive workup, and it's because of that extensive workup that they do so well after surgery. True or false? A living donor can no longer play sports or exercise after donation. That's absolutely false. Once again, we usually want people to stop strenuous exercises for about a month, but after a month or 6 weeks, they can get back to any sort of activity. The other question that comes up a lot in evaluating live donors is that a living donor can no longer drink alcohol. That's just not true. Moderate drinking is fine. Pretty much any activity you have before you donate, you can have after donation. A kidney donor has to take medications for the rest of their life. That is not true. People that donate their kidneys usually are not taking any medicines, and other than the pain medicines that are a short period of time, they don't need any additional medicines. Now, on occasion, people that are donating may take medicines for various conditions, like a thyroid condition or even high blood pressure. They're taking one small medication for high blood pressure, and they'll continue those sorts of medicines. But for the most part, people that donate their kidney do not need to take any new medications after donation. All right, so for kidney donors, the recipient's insurance, this is important to understand. The recipient, the person getting the kidney, their insurance covers the operation and anything to do with the donation, all of the testing, all of the money that's needed for that person to become a donor is covered through the recipient insurance. So all the medical expenses that are associated with being a live donor are covered. And the donor does not have to worry about any sort of out-of-pocket expenses. For people that are of low income, and because they have to take time off from work, etc., these expenses can also be covered through special programs that the social worker at the transplant center can get the person plugged into. So we try as best as we can to defray all the costs associated with donating a kidney. What's not covered are travel expenses, housing, food, lost wages, child care. That's not covered in general, but like I said, there are special programs for people that are of low income. Your income can be plugged into an algorithm, and if you meet the requirements, there is government funding to cover some of these things that are typically not covered by the recipient insurance. These programs have been actually expanded in recent years because the government sees the importance of actually increasing live donor kidney rates in this country. Pregnancy after donation. This is very important. Can you become pregnant after donating your kidney, and what are the risks? I will tell you that yes, you can become pregnant after you donate. It is considered a high-risk donation. a high-risk pregnancy, and you need to be followed by a high-risk OB obstetricianist. However, many people have donated their kidney and then had successful pregnancies. It is not a deterrent in any way, so should not be seen as a deterrent. The only issue is that most programs would have you wait at least a year after you donated your kidney to become pregnant. And like I said, you need to be followed by a high-risk obstetricianist, because pregnancy in and of itself, even if you have two kidneys, puts a strain on your kidneys. And if you have one kidney, it puts a strain on that one kidney. But usually it's not an issue, and you just need to be followed carefully. So yes, the answer is absolutely. You can become pregnant after donation. True or false? A kidney donor's sex life is negatively affected by donation. That is false. That is not true. After you heal up from donating, your sex life will be as it was before. So that can run the gamut depending on the person, but it is not negatively affected. And usually a few weeks after the operation, the person can go back to a normal sex life. A female kidney donor cannot get pregnant after donation. We already dealt with that. A female kidney donor can definitely become pregnant. One of the interesting things on the other side, talking about the recipient side, so after a person gets a transplant, they also can become pregnant. So a female that gets a transplant will go from being infertile, because kidney disease makes people infertile. And after a few months of having good kidney function, a person that was infertile because of their kidney disease will then become fertile and can become pregnant. And that's why this sort of education needs to be done, and people need to use barriers or contraception, and maybe they didn't have to before, because females and males that have kidney disease are infertile. After a few months of kidney function, they become fertile. And then we will counsel our patients usually to wait about a year. But after a year of receiving a transplant, you can become pregnant on the recipient side and definitely on the donor side. So what are the novel strategies to increase transplant rates? One of them that I actually don't have listed here is what's called accepting high-risk donors. What we will offer to our patients is to actually sign up to receive a kidney from a high-risk donor. What is a high-risk donor? Now, of course, here I'm talking about deceased donors. So the transplant program will have you sign a separate consent to receive a high-risk donor. A high-risk donor is a donor that usually has died because of a drug overdose. They're at higher risk of transmitting a virus or viral disease. However, because of the way viral testing is done in people that are being evaluated to be a donor, there's a virtual 0% chance that a negative test would be falsely negative. In other words, a person that's going to be a donor, a deceased donor, we would do a blood test. It's called nucleotide testing, and we will make sure that there is no HIV or hepatitis B or hepatitis C or any of these viral elements in their blood. And they would have to pass these tests in order to be a kidney donor. So one of the things you will do to increase your transplant rate or your chance of getting a transplant is to sign up for a high-risk donor. The other thing that we will do is we will do what's called paired kidney exchanges. What that means is you may have a live donor that wants to donate to you, but for whatever reason you don't match. Your different blood types, or the more common scenario is a woman needs a transplant from her husband, and because she's had children for her husband, she may have built up some antibodies to him, and therefore he cannot be a direct donor to her. In that scenario, what we will have occur is that we will allow her husband to donate his kidney to someone else, and then someone else's donor, who is likely also incompatible, will donate to her. That's called a paired kidney exchange. That's one of the things we can do to increase transplant rates. We will also do what's called ABO incompatible transplants. People that have different blood types, we can give them special medicines. We can put their blood through a special filter that will allow them to get a kidney from someone of a different blood type. These are ways or things we can do to increase the chance of someone getting a transplant. And remember, this is important because this is life or death. If you need a transplant, you need to get that transplant because statistically speaking, you have a huge advantage on having a longer life if you get a transplant versus a person that has to sit on dialysis. This is the way a paired exchange works. like I said, you take one incompatible pair and pair them up to another incompatible pair. Or you could have what's called a chain or a domino paired exchange. What that means is someone sets off the chain reaction. You have a donor, we call them a non-directed, meaning that we at our program, we get people that come forward and they just want to donate a kidney to someone that needs it. They really don't care who the kidney goes to. So they will set off a chain reaction because we will take that kidney and we will give it to someone who has a donor and then allow their donor to give to another person that needs a transplant. And then this can set off a chain reaction. That chain can go on and on and on. And we have done this on many occasions. We do at least 4 or 5 exchanges per year at our program, and these are done at programs all over the country, including national chains that can go through many transplant centers throughout many states across the union. What you're seeing here is some of the paired exchanges that we've done at my center, and we bring these people together because they become like family. When someone gives you a kidney that saves your life, they are linked with you forever. So these are all situations where live donors were done through a paired exchange. True or false? A kidney donor and recipient must be related by blood. Absolutely not true. For matter of fact, most of the live kidney donor transplants that are done nationwide are not between people that are related by blood. Now, it is true that your best chance of finding a match is going to be someone who you are related to by blood, particularly a sibling or a parent, but you don't have to be related to someone by blood in order for them to be your donor. Anyone who is healthy enough to be a donor can donate a kidney to you. A living kidney donor has to be the same blood type. We've already covered that. The answer is no. You do not need to be the same blood type because we can match up people of different blood types and give special medications and do special procedures to make sure that those kidney transplants work great. This is a poster that we recently presented at a national meeting. And what we were showing in this poster was that we could transplant people even of different blood types if we would do the special procedures that I was just talking about. The point is, what I firmly believe and what I've shown in my career is that everything that we can muster to try to get people to get a transplant must be done in order to make the transplant happen rather than not allowing a person to get a transplant in a timely fashion. Because time is of the essence. The longer you sit on dialysis, the less likely you are to qualify to be a transplant, the more likely you are to develop a problem that will keep you from qualifying to be put on a kidney transplant list, and the more problems you could develop that will make transplant impossible. So time is of the essence. You want to try to get on a list as soon as possible. You want to try to identify live donors as soon as possible. You want to sign up for every caveat the transplant center might have as to how you can qualify for a transplant, and you need to get transplanted because statistically speaking, your life expectancy is going to be much, much longer. What are the ways that we've adopted to increase awareness? Well, it's kind of what we're doing right here. People need to hear about what are the options. They need to know what are their best options. This is going to be through outreach, through education. We do all sorts of screening programs at my program because it's important for people to learn as soon as possible if they are even at risk of end-stage kidney disease. Remember, there are 5 stages of kidney disease, 5. And the first 3 of the 5 stages are reversible for the most part. You know, the first 2 stages of kidney disease, which just means that you have an abnormal amount of protein in your urine, if you get rid of why you're developing this protein in your urine, you get rid of your kidney failure risk. What are the reasons why people would have a lot of protein in their urine? Well, number one is going to be because of either high blood pressure or diabetes or a precursor thereof. In other words, a little bit of the high blood pressure or the diabetes. I always tell people that's like being a little bit pregnant. If you have high blood pressure, it needs to be treated. It needs to get down to the normal range. If you have diabetes, if your sugars are high, it needs to be treated. It needs to get down into the normal range. Usually that's going to mean that you need to lose weight, you need to exercise, you need to change your diet. These are the things that people need to hear in order to prevent kidney disease. Kidney disease is preventable if people treat the problems that led to their disease before they get to stage 4 or 5. Again, there are 5 stages. First 3 stages are reversible. The last 2 stages are not. That's when you're going to go on to dialysis and need transplant. We need to utilize all of the possible ways of getting in touch with people, including health fairs, social media, whatever, to let people know that kidney disease is a killer and it is preventable. These are just examples of us being in the community. James Brown has been a big advocate for educating people about kidney disease. You know, he's very famous as an ex-basketball player and a football commentator, but he's also seen kidney disease in his family, and that's why people like him are advocates of education of the masses so that people can find out if they are at risk of kidney disease and what they can do about it. This is a postcard that we send out to celebrate our kidney donors. Everyone you see in that postcard donated a kidney to someone in order to save their life. Sometimes it was a family member. Sometimes it was a friend. Sometimes it was a stranger. But the point is, only through people doing something that is so selfless. I mean, these are absolute heroes. These are people that said, you know what, I am going to step forward and save someone's life because I can. When you give someone a kidney, you are adding upwards of a decade of life to that person. It truly is unprecedented in how long of a life expectancy is granted through giving someone a kidney. Again, I wanted to go back to the screening. And what I want people to understand is that in my program, we are finding that in general screening, more than 25% of the people we go out and screen for kidney disease. Someone needs to put their phone on mute. But anyway, we have found that more than 25% of these people wind up having abnormal screening. In other words, protein in their urine. Again, we want people to sign up to be donors after death, right? So that's usually going to be at the DMV when you're signing up to be to get your license. You sign the back of your license to be a kidney donor. One donor can save 7 lives.
Oh, okay.
Before I get to the questions, I just want to say one last thing, and that is,
can you hear that?
What does it mean to get transplant wait time? You know, everyone that on dialysis, once you go in and get evaluated for transplant, you actually will get wait time for your dialysis time. So let's say you've been on dialysis for 2 years, and then you come in and you get evaluated for a transplant. Once you are activated on that transplant list, you then get 2 years of wait time. That's important because most people around this country need to be on the transplant list for about 4 to 5 years at least before they will qualify to actually get a transplant. So transplant wait time is very, very important.
And we will have the recording on our website in about a week and the slides. And so thank you everyone for attending today. Please fill out the feedback form. We value your opinions as well as what future topics you would like to see. And please join us next month on November 21st to learn more about the treatment and modality options for kidney disease. Thank you everyone for attending, and Dr. Lonson, thank you again for having us in your schedule today.
No problem, and thanks guys, I appreciate it.
Okay, thank you.